Drug treatment of congestive cardiac failure. First of all, you should know what do you mean by congestive cardiac failure, or it is also known as a congestive heart failure, CHF or CCF. CCF means congestive cardiac failure, CHF means congestive heart failure. Both are the same term, and again sometimes it is also called as a heart failure itself. So what is meant by heart failure, what is meant by congestive cardiac failure, that I will explain. So before that you should know the certain terms and certain physiology behind the cardiac muscle contraction, how heart muscle contracts, you should know. So I will explain one by one that these terms, because these terms, they are very important if you want to understand this drug used in the congestive cardiac failure. So first of all, so there is a little bit difference between your normal cell and your cardiac cell. So there is little bit difference between normal cell and cardiac cell. And what is the difference? So cardiac cell, nothing but they used to undergo spontaneous depolarization, and normal cells, they used to get excited when the stimulus will. So normal cell, they used to they used to excite, or they used to contact when there is a neuronal stimulus or when there is a nervous stimulus. But cardiac cell, they have their property. They have the one property, that is nothing but the automaticity. They have one property, automaticity. Automaticity means it is the ability of certain types of cell in the cardiac tissue which will undergo spontaneous depolarization without any external stimulus. So that is known as automaticity. This automaticity is present in the heart, particularly it is highest at SA node. So SA node is known as a pacemaker of your heart. So SA node will generate the impulse and will transmit the impulse. AV node also will generate the impulse at a lower rate than SA node. It will also transmit the impulse. That impulse will be transmitted through SA node, AV node, and then Purkinje fiber into ventricles. So that is nothing but the known as a conduction system of heart. So your heart is made up of two types of cell. First one is known as the cells which are responsible for the generation of impulse and transmission of impulse. Here these cells will have automaticity. Okay, these cells will have property of automaticity. And another type of cell is known as a muscle cell. Okay, another type of cell is known as a muscle cell, and those responsible for the contraction of your myocardium. So myocardial muscle, they contract because of they have property of contractility. There are two types of muscle in the heart. There are two type of cells in the heart. So first cell or first group of cell responsible for the impulse generation and impulse transmission. Okay, and in that type of cell they have property known as automaticity. So automaticity is nothing but the property of cell. It is the property of cardiac cell to undergo spontaneous depolarization to generate the impulse. They are self, they generate the impulse by their own, and that is nothing but the automaticity. They have one property known as automaticity. So this automaticity is highest in the SA node in case of your heart, and then after that your AV node also has a automaticity. And every whatever the elements are there in the conduction system, like SA node, AV node, Purkinje fibers. So every cell in these elements, they have automaticity. So automaticity means property of cardiac cell to undergo spontaneous diastolic depolarization. So that is automaticity. And there are another kind of cell in the heart known as a responsible for the contractility, means they are responsible for the contraction after the stimulus. This stimulus will be generated by this SA node, AV node, and it will be transmitted to a myocardial cells. They are responsible for the contraction. Okay. So automaticity. Then excitability means what? Excitability means the cell will undergo depolarization upon impulse. Upon impulse, when a impulse will reach to a particular cell, it will go undergo depolarization and excitation. So that is known as a excitability. So excitability मतलब क्या है कि जैसे इम्पल्स आता है कोई सेल को, कार्डियक सेल को, तो कार्डियक सेल क्या होगा, एक्साइट होगा, वो कॉन्ट्रैक्ट हुआ, उसको बोलेंगे अपन एक्साइटेबिलिटी. ठीक है. ऑटोमेटिसिटी किसको बोलेंगे? ऑटोमेटिसिटी मतलब क्या है? कार्डियक 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 में कुछ ऐसे सेल्स होते हैं जैसे एसए नोड हो गया, एवी नोड हो गया, पर्किंज फाइबर. सो ऑल दीज, ये तीनों को क्या बोलते हैं? कंडक्शन सिस्टम ऑफ ब्लड. तो उसके इसमें एक प्रॉपर्टी होता है. सो दीज सेल्स विल हैव प्रॉपर्टी to undergo spontaneous diastolic depolarization without any external impulse. वहां पे कोई भी स्टिमुलस नहीं है, फिर भी वो अपना अपना ही डीपोलराइज होते हैं टाइम टू टाइम। डीपोलराइजेशन एक साइकिल हो गया तो दूसरा साइकिल कंटिन्यूस। सो स्पॉन्टेनियस डायस्टोलिक डीपोलराइजेशन दैट इज नथिंग बट द ऑटोमेटिसिटी। एक्साइटेबिलिटी इज नथिंग बट द contraction of cell or depolarization of cell upon external stimulus or impulse. Then contractility means it is a function of contraction of myocardium. Okay, now third term is nothing but the fourth term is nothing but the cardiac action potential. So cardiac action potential means what do you mean by cardiac action potential? So when SA node will generate the impulse, it will transmit the impulse through a AV node and Purkinje fiber. That impulse will reach to the myocardial muscle of your heart. Okay, at that time what will happen? There is a there is a there is a episode, there is a synchronous episode, or there is a particular movement of ions inside the cell and outside the cell. So there will be movement, there will start a movement of ions inside the cell and outside cell. So to generate one particular cycle known as a cardiac action potential. Now, cardiac action potential, how it is there? So in case of cardiac cell, cardiac muscle cell, okay. So there is a negative potential inside the cell. Inside the cell there is a negative potential. तो नेगेटिव पोटेंशियल मतलब क्या है? यहाँ पे माइनस मिली वोल्ट में यहाँ पे पोटेंशियल रहेगा। आप बोलेंगे यहाँ पे पोटेंशियल क्या कर रहा है, कहाँ से आया? सो आपको मालूम है, यू नो दैट, सो इन द मसल्स एंड सेल्स you will have certain kinds of anions and cations. So there is a anions like chloride, phosphate, okay, cations like sodium, potassium, calcium. So sodium, calcium, they are principally known as a extracellular cations. पोटेशियम इज नोन एज इंट्रासेलुलर कैटायन। पोटेशियम सेल के अंदर रहता है, कैल्शियम सोडियम बाहर रहते हैं। क्लोराइड इज नोन एज extracellular anion, right? So in the cardiac cell, okay, suppose that this is the circle is your cell, in the this there is a negative potential, okay. In the cardiac cell there is a negative potential, is minus. Suppose it is around minus 90 to minus 95, or you can say it is a around minus 85 to minus 90 millivolt, okay. So it is inside potential, and outside it is positive because of there is presence of calcium, sodium and other cations in the blood plasma, okay. Now what happens, as I have told you, this potassium is known as intracellular cation. Potassium is known as intracellular cation, okay. Potassium क्या है? Intracellular cation. So potassium will start leaking, it will leak from cell to the outside. तो पोटेशियम सेल के बाहर आना चालू हो जाएगा। पोटेशियम सेल के बाहर आना चालू हो गया तो ये, so whatever negative potential is there, that will decrease. It will decrease from minus 90 millivolt to around minus 85 millivolt. When this minus 85 millivolt potential will be there in the cardiac cell, this potential is known as a threshold potential. It is known as a threshold potential. It is known as a threshold potential, TP. And after that, when there is a, if there is a threshold potential is reached in the cardiac cell, so there will be suddenly entry of sodium ion inside the cell. Sodium ion यहाँ पे enter करेगा, सोडियम के साथ में कैल्शियम भी enter करेगा। As soon as there is a reach of your threshold potential in the cardiac cell because of the leakage of potassium ion channel, so there will be sudden entry of sodium and calcium. Sodium and calcium are nothing but the positive ion, that is known as a cation, and they will change the intracellular negativity. They will turn negative potential into positive potential, okay. At this time, sudden entry of sodium, that is known as phase 0 of cardiac excitation potential, phase 0, okay. Along with this sodium, some calcium will go inside the cell, and up to this point, once the potential is converted into positive potential, so immediately at this point sodium ion channels will be closed and potassium ion channel will be opened. So potassium ion will be opened. Potassium ion will go from inside the cell to the outside the cell, and chloride ions will also enter the cell. So that's why there is a little bit this. It is known as a phase 0 is known as a spontaneous depolarization, and or rapid depolarization. It is known as a rapid depolarization, and this phase 1 is known as a quick repolarization. After that, still this phase, calcium goes inside, calcium travels inside, okay, and potassium goes outside. So due to imbalance between going imbalance between entry of calcium and exit of potassium from the cell. So there is a second phase known as a plateau level. Okay? And okay, after this third phase start. Third phase is nothing but the it is a it is a repolarization. It is known as a rapid repolarization. There is a removal of sodium and calcium from inside the cell. Okay, and potassium will go inside the cell. Sodium will come out from the cell, calcium will come out from the cell, and sodium will enter in the cell, and it will maintain the again resting membrane potential. Resting membrane potential मतलब क्या? Normal potential of the cell कितना होता है? Normal potential -90 millivolt. So resting membrane potential RMP. So there will be removal of calcium and sodium out of the cell, and cell will try to establish its resting membrane potential, that is -90 millivolt. Okay, and again once this cycle is completed, again another cycle will start. Okay, 0 1 2 3 4, and again 0 1 2 3 4. So this is known as a cardiac action potential. Okay, cardiac action potential. Now what happens during the during this phase 0, during this phase 0 and phase 2, during these two phases, phase 0 and phase 2. So if there is another impulse, if there is another impulse for the depolarization, okay, but depolarization will not happen in this phase. So during 0 phase and during 1 and 2 phase, though there is another impulse, so depolarization will not. Okay, so this period is known as a absolute refractory period. Okay, this period is known as a absolute refractory period. What is it? It is the period, it is the period in which, though there is a strong stimulus to the cardiac cell again to depolarize, but depolarization will not occur. That is known as a absolute refractory period. Okay, so that is nothing but the ERP, absolute refractory period, or effective refractory period, same term. ERP and absolute refractory period. So during this period, if there is another stimulus to cardiac cell will not get depolarized. Now third phase is known as the repolarization. Okay, and now in this phase, so if there is another stimulus during phase 3, if there is a strong stimulus during phase 3 of depolarization of cardiac cell, or another stimulus can depolarize the cell. Okay, and that's why it is known as a relative refractory period. ओके, एब्सोल्यूट रिफ्रैक्टरी पीरियड, ये जो इस टाइम पे क्या होता है कि दूसरा कोई स्टिमुलस आ गया दूसरा, तो दो बार वहां पे डिपोलेशन नहीं हुआ. यहाँ पे एब्सोल्यूट रिफ्रैक्टिव पीरियड चल रहा है, फेज 0 एंड फेज 1. उस टाइम पे दूसरा उतना भी स्ट्रॉन्ग स्टिमुलस आया, फिर भी वहां पे डिपोलराइजेशन नहीं होगा. ड्यूरिंग द ARP और एब्सोल्यूट रिफ्रैक्टिव पीरियड, दो देयर इज अनदर स्टिमुलस, it will not cause depolarization. But now in case of refractory period, if there is a strong stimulus, so that can initiate another depolarization. Now another term is there known as a cardiac output. What do you mean by cardiac output? So amount of blood which is being pumped, per stroke of your heart, per beat of your heart, from the left ventricle. So whatever amount of blood is being pumped per beat through a left ventricle, known as a cardiac output. Okay, now cardiac output is a function of your stroke volume and heart rate. SV means stroke volume and into heart rate. So cardiac output is equal to stroke volume into heart rate. Now stroke volume itself is given by these two terms. Stroke volume itself is given by these two terms, or it is governed by these two terms, known as a preload and afterload. So what do you mean by preload? So the amount of blood present in the ventricle, amount of blood present in the left ventricle, particularly amount of blood present in the left ventricle before its systole, before the contraction of left ventricle. So whatever amount of blood is present in the left ventricle before the contraction is known as a preload. Okay, preload. And that blood is nothing but the venous return, जो भी कलेक्शन हुआ है ब्लड का फ्रॉम बॉडी, वेन्स ने जो भी ब्लड कलेक्ट किया बॉडी से, वो कहाँ ला के रख देगा? वो पहले तो रख के रख देगा आपका एट्रिया में, एट्रिया से वेंट्रिकल में जाएगा, राइट वेंट्रिकल में, राइट वेंट्रिकल से जाएगा आपका लंग्स में, और फिर से लेफ्ट आर्ट्रिया में आएगा, और उसके बाद में लेफ्ट वेंट्रिकल में आएगा. सो दैट इज नथिंग बट द वेनस ब्लड. ओके, सो प्रीलोड मीन्स द अमाउंट ऑफ ब्लड which is present in the left ventricle before the contraction of left ventricle, that is a preload, and it is nothing but the venous return. Okay, so preload means venous return is nothing but the preload. Now what is meant by afterload? Afterload is nothing but the resistance to left ventricular ejection. So left ventricle जब contract होता है, so when there is a contraction of left ventricle, so whatever oppose is there, so whatever resistance is there, that is known as the afterload. Now this resistance is done by, resistance is offered by your arteries. So okay, so arteries resistance offer करते हैं, it will offer a resistance for the ventricular ejection. So whatever resistance offered by arteries, that is known as the afterload. Okay, now preload and afterload, they decides stroke volume. Okay, this one is known as a absolute refractory period. Okay, so during the phase 0 up to the phase second, so if there is another stimulus to cardiac cell, ये दोनों फेज जब तक है, वो फेज में दूसरा कोई स्टिमुलस आता है कार्डियक सेल को, तो फिर भी वो स्टिमुलस को रिस्पॉन्ड नहीं करेगा आपका सेल. कार्डियक सेल विल नॉट रिस्पॉन्ड टू अनदर स्टिमुलस during this phase 0 to phase 2, and this period is known as a effective refractory period, or it is also known as a absolute refractory period. In this third phase, which is known as a repolarization phase, so during this third phase, if there is another impulse or strong stimulus, cardiac cell can respond to that stimulus and can do another depolarization, and this period is known as a relative refractory period. ये period जो है, that is known as a RR, relative refractory period. So in the absolute refractory period, your cardiac cell will not respond to another impulse. In the relative refractory period, your cardiac cell will respond to another impulse. What do you mean by congestive cardiac failure? So what is meant by congestive cardiac failure? If your myocardium is not able to pump the blood forcefully to meet the body's demand, that is nothing but the heart failure. That is nothing but the congestive cardiac failure. So heart failure is nothing but the inability of heart to pump the blood. So inability of heart to pump the blood. Heart failure is nothing but the inability of heart to maintain a cardiac output adequate to meet the body's demand, body's metabolic demand. It may be a acute heart failure, or it may be a chronic heart failure. So acute heart failure is because of the myocardial infarction. Most of the time, acute heart failure is because of the myocardial infarction, and chronic heart failure is because of the different reason. Chronic heart failure may be due to this kidney disease or vascular disease, kidney disease, or infection, etc. But acute heart failure may be due to myocardial infarction or genetic origin. Now, basically, heart failure means what? Heart failure or congestive cardiac failure means what? So, if your heart is not able to pump the blood properly, so normally क्या होता है? What happens normally? If you are not doing anything, you are not doing any physical work, you are just sitting. So at the time also your heart is able to pump the blood. So your heart is pumping the blood to meet the body's requirement. At the rest, when you are at the rest, still your heart is working. But if you start doing exercise, at that time what will happen? So your cardiac output will increase because you are doing exercise. Your muscle cell, your body needs more blood. At that time, during the exercise, your need of oxygen and blood is increased. So in turns cardiac output need is also increased. So again your heart, if it is a normal, it will meet the demand by increasing the heart rate and cardiac output. And now at rest there is a less cardiac output required. So at that time heart will relax and it will decrease the cardiac output. That is a normal thing. Now what happens if in case of your if you are suffering from any disease like myocardial infarction or any endocarditis or myocarditis or any vascular disorder, blood vessel disorder, or if any kidney disease, so what will happen? You look normal at the rest. If you are not doing any work, you just simply you are sitting and reading or doing something. At that time, body's requirement of cardiac output is less. At that time, your heart will able to fulfill that. But when you are doing exercise, if you start doing exercise, at that time your demand of your body, that is cardiac output, will increase, and at that time your heart will not able to supply that cardiac output. Okay, so that at that time you are suffering from heart failure. तो आपने देखा होगा बहुत सारे न्यूज आते हैं कि कोई एक्टर है कि वो एक्टर सडनली एक्सरसाइज करते करते कोलैप्स हो गया और उसका हार्ट अटैक है. So that is nothing but the same thing. Okay, whatever I have explained, that is nothing but the same thing. So at least recently, two actors I say there was two actors. One is actor from South and one is from our Bollywood industry who has been collapsed during exercise. That was the scenario with them. So before understanding what is the problem, you should know what is the physiology behind the cardiac muscle contraction. Okay, so physiology of cardiac contraction. So normally cardiac means what? Cardiac means myocardium. So myocardium will have particular type of cell known as a myocytes. So your myocardium or cardiac muscle will have cells known as a myocardial cells. So structural and functional unit of your cardiac muscle, they are nothing but the sarcomere or it is known as a myocytes. Okay. Now these myocytes are nothing but they are having two type of cell with alternate dark and light bands. Okay. So two type of cell, they are having filaments. Okay, so these myocytes are having two type of filament. One is a thin and one is a thick. So thin filament is known as a actin and thick filament is known as a myosin. तो जो पतला है उसको बोलेंगे एक्टिन, जो जाड़ा है उसको बोलेंगे मायोसिन. तो योर कार्डियक मसल सेल नोन एज अ मायोसाइट जो कॉन्ट्रैक्शन के लिए रिस्पॉन्सिबल है. So these myocytes comprises your myocardium. Myocardium is made up of myocytes only. Okay, now myocytes itself they will have two type of myofilament known as one is actin which is thinner and another is a myosin which is a thicker. Okay, now stimulation of these myocytes causes the contraction of your heart and pumps the blood to your body. Now these filaments actin and myosin. So out of that myosin is supplied with the one enzyme. So myosin has some intrinsic enzymatic activity known as ATPase. तो मायोसिन में एटीपेज नाम का एंजाइम होता है. ठीक है, जैसे ही मायोसिन एक्टिन के साथ में कंबाइन होता है कैल्शियम के थ्रू, तो उस टाइम पे ये एटीपेज क्या करता है, ब्रेक डाउन ऑफ एटीपी, एंड दैट ब्रेक डाउन ऑफ एटीपी मींस योर myocytes will have energy. So myosin has intrinsic enzymatic ATPase activity sites, whereas the actin possesses the ability to combine reversibly with the myosin in presence of ATPase and calcium. ठीक है, सो मायोसिन में एटीपेज नाम का एंजाइम होता है और एक्टिन एक्टिन जो होता है उसको एक प्रॉपर्टी होता है कि वो मायोसिन के साथ में कंबाइन होता है इन प्रेजेंस ऑफ एटीपेज एंड कैल्शियम. व्हेन एक्टिन कंबाइंस विद द मायोसिन दैट टाइम देयर इज अ कॉन्ट्रैक्शन ऑफ योर मसल. Calcium activate the myosin ATPase. Who activate the myosin ATPase? Calcium ion activate the myosin ATPase. So there must be a free calcium inside the cardiac cell to cause the contraction. Okay. So calcium activates the myosin ATPase which break downs the ATP. That is nothing but that is the supply of energy for the contraction. Okay. Inotropic action or contraction of your heart cell. Inotropic action means contraction of your myocardial cell or myocardial muscle. So it is because of the increased intracytoplasmic. So whatever myocytes are there, myocardium का जो सेल होता है myocytes, उसके अंदर कैल्शियम आयन कितना है, इनसाइड कितना है, जितना ज्यादा कैल्शियम आयन इनसाइड रहेगा उतना ज्यादा फोर्सफुल कॉन्ट्रैक्शन होगा. तो inotropic action of heart is because of the increased intracytoplasmic calcium. So cardiac contraction and relaxation is because of the changing in the concentration of calcium in the myocardial cytosol. So myocardial cell जो होता है उसके अंदर कैल्शियम का कितना कॉन्सेंट्रेशन है ज्यादा, ठीक है, वो डिसाइड करेगा कितना फोर्सफुल कॉन्ट्रैक्शन हो रहा है. ठीक है, तो अंदर जाना बाहर आना कैल्शियम का डिसाइड करता है कि कॉन्ट्रैक्शन रिलैक्सेशन. ठीक है, ये याद रखो. दिस इज द मेन फिजियोलॉजी. ओके, नाउ विल सी what is meant by cardiac output. It is nothing but the amount of blood that is ejected through left ventricle per stroke. Okay, so determined by preload. Preload means ventricular end diastolic pressure, myocardial contractility and afterload. So cardiac output is decided by three terms. First is nothing but the preload. What is preload? I have already explained. So whatever venous blood is there in the ventricles, whatever venous blood is there in the left ventricle, that is known as a preload. Okay, and what is myocardial contractility? It is the ability of myocardium to get contracted or to pump the blood from heart. Okay, then afterload means what? It is nothing but the resistance offered by arteries. Resistance offered by arteries. जो arteries होते हैं आपके arteries जो resistance offer करते हैं for the left ventricular ejection. That is nothing but the afterload. So cardiac output is mainly determined by or mainly decided by three terms: preload, myocardial contractility, and then your afterload. Okay, when myocardial contractility is impaired or it is when it is decreased, when myocardial contractility, the ability of myocardium to contract forcefully, आपके हार्ट का मसल जो है फोर्सफुल कॉन्ट्रेक्शन होना अगर वो कम हो गया, सो मायोकार्डियल कॉन्ट्रेक्टिलिटी इज इम्पेयर्ड एंड वेंट्रिकल डायलेट्स. जब वो कम होता है मायोकार्डियल कॉन्ट्रेक्टिलिटी, तो क्या होता है कि मायोकार्डियम विल नॉट एबल टू force or will not able to pump the blood fully. Whatever blood is in the left ventricle, that will not be able to pump it. Okay, जितना ब्लड लेफ्ट वेंट्रिकल में है उतना बाहर नहीं डाल सकता, उतना पंप नहीं कर सकता आपका हार्ट. क्यों? क्योंकि आपका मायोकार्डियल कॉन्ट्रेक्टिलिटी कम हुआ है बिकॉज ऑफ द वैरायटी ऑफ रीजन. ठीक है, जैसे मान लीजिए कि आपको मायोकार्डियल इन्फेक्शन हो गया, सो मायोकार्डिटिस. ओके, so endocarditis, myocardial infection, etc. So if there is a infection or if there is impact, myocardial infection, so at that time your myocardial cell will die. At that time also your myocardial muscle will not able to contract forcefully and will not able to pump the amount of blood present in the ventricle. Now what happens if myocardium is not able to pump your blood, whatever blood is present in the left ventricle, so it will pump only limited blood and it will your ventricle will have some reserve blood. Okay, and again from venous return is there. So वेन से ब्लड आ रहा है आपके हार्ट में, पूरा वेन्स ब्लड लेके आ रहा है हार्ट में, हार्ट में ब्लड जमा हो रहा है और हार्ट क्या कर रहा है, जितना जमा हो रहा है उतना ब्लड फोर्सफुली पंप नहीं कर पा रहा है, उसमें का कुछ अमाउंट पंप कर रहा है, बाकी का वैसा की वैसा रहने दे रहा है बिकॉज ऑफ द मायोकार्डियल इम्पेयर्ड कॉन्ट्रेक्टिलिटी. सो व्हाट विल हैपन, तो आपके हार्ट में ब्लड जमा होना चालू हो जाएगा और उसमें क्या होगा कि आपका हार्ट डायलेट हो जाएगा. ठीक है, आपके हार्ट का साइज बड़ा हो जाएगा. दैट इज नोन एज अ कार्डियक डायलेशन. ओके, तो कार्डियक डायलेशन and cardiac dilation will occur because of that decreased myocardial contractility, and because of that decreased myocardial contractility your heart your cardiac output will also decrease. Okay, and decrease in the cardiac output, dilation of your heart, and afterload is increased. Then due to increased venous return, so pulmonary vein में क्या हो जाएगा, प्रेशर बढ़ जाएगा. So there will be increase in the pressure in the pulmonary vein, there will be increase in the pressure in the peripheral arteries. Okay, so increase the pressure in the pulmonary vein causes pulmonary edema, dyspnea means less breathing. Okay, then increase the pressure in the peripheral blood vessels, they causes the peripheral edema. ठीक है, pulmonary edema मतलब pulmonary जो वेन्स है उसमें सूजन आएगा, पेरिफेरल एडिमा मतलब बाकी पूरा बॉडी में सूजन आएगा, लीवर एनलार्जमेंट हो जाएगा. So there will be liver enlargement, peripheral edema, pulmonary edema, dyspnea, and decreased cardiac output. And that is nothing but the congestive cardiac failure. Okay, वहाँ पे कंजेशन हो रहा है, हार्ट में जमा हो रहा है ब्लड, और ब्लड तो जमा हो रहा है लेकिन वो ब्लड पूरा पंप नहीं हो रहा है, थोड़ा सा ही पंप हो रहा है, बाकी का उसमें रह रहा है. और आने का सब कुछ मतलब हार्ट इज रिसीविंग whole blood from veins, but heart is not able to pump the whole blood due to decreased myocardial capacity, decreased myocardial contractility due to variety of reason, and this is known as a congestive cardiac failure. So resultant, okay, now what happened, there is a decrease in your cardiac output due to myocardial contractility. Okay, so resultant, so there is some compensatory mechanism. जैसे ही आपका हार्ट का मायोकार्डियल कॉन्ट्रेक्टिलिटी कम हो गया, कार्डियक आउटपुट कम हो गया, तो आपका जो रिसेप्टर्स है, बायो रिसेप्टर्स, दे विल स्टिमुलेट द ब्रेन and they will inform the brain that is there is a decrease in the cardiac output. So your brain will stimulate sympathetic nervous system. It will stimulate the sympathetic nervous system and release the noradrenaline. Resultant neuronal and hormonal stimuli. Neuronal and hormonal stimuli. So neuronal stimuli means your adrenergic system activation or sympathetic system activation due in response to decreased cardiac output, and hormonal stimuli means renin, angiotensin, aldosterone system activation due to decreased blood flow to the kidney. So they will be activated due to decreased cardiac output, and in turn again contribute to increase the afterload. How they will contribute I will explain later. Okay, this reduces the cardiac output again while increasing the myocardial oxygen requirement. Okay, so myocardial oxygen requirement increase हो रहा है, afterload ओके, तो आफ्टर लोड जैसे कार्डियक आउटपुट कम हो गया, आपका सिंपैथेटिक स्टिमुलेशन हो गया, अल्डोस्टेरोन का मतलब रेनिन एंजियोटेंसिन अल्डोस्टेरोन सिस्टम एक्टिवेट हो गया, तो वो भी क्या करेगा, वो भी आपका प्री लोड बनाएगा और वॉल्यूम बढ़ाएगा, ठीक है। और ऑलरेडी आपके हार्ट में वॉल्यूम ज़्यादा है, सो प्री लोड बढ़ाएगा, आफ्टर लोड बढ़ाएगा, वॉल्यूम बढ़ाएगा, तो ऑब्वियसली पहले ही आपका कार्डियक आउटपुट कम हो गया है और फिर से ये सब बन रहा है, तो आपके हार्ट में कंजेशन हो जाएगा, आपका हार्ट डायलेट हो जाएगा, सो योर कार्डियो मेगेली हो जाएगा, कार्डियो मेगेली। These are the two compensating mechanism. They initially the compensating mechanism they are for to increase the cardiac output, but they will increase for only short time. Okay, short term. Now, heart failure is due to different reason. For example, heart failure may be due to severe anemia. Heart failure may be due to severe anemia. Thyrotoxicosis. Thyrotoxicosis means increased thyroid hormone. Then vitamin B6 deficiency, myocardial infarction. So I have told you there are two type of heart failure: acute heart failure and chronic heart failure. So acute heart failure is because of the myocardial infarction. Okay, myocardial infarction or genetic disease, and other chronic heart failure is because of the anemia, thyrotoxicosis, vitamin B6 deficiency, then infection to the heart, endocarditis or myocarditis. Most sensitive index for cardiac output determination is left ventricular ejection fraction. So whatever amount of blood that is being pumped, okay, that is being pumped by left ventricle per systole, per systole. So most sensitive index for cardiac output determination. How can you decide आप cardiac output कितना है decide कैसे करोगे? So उसके लिए क्या है कि लेफ्ट वेंट्रिकुलर इजेक्शन फ्रैक्शन कितना है आपका, तो वो डिसाइड करता है कि कार्डियक आउटपुट कितना है. सो मोस्ट सेंसिटिव कार्डियक आउटपुट डिटरमिनेंट इज नथिंग बट द लेफ्ट वेंट्रिकुलर इजेक्शन फ्रैक्शन. So normally left ventricular ejection fraction means the amount of blood that is being pumped per stroke per systole of ventricular contraction. Okay, so normally it is around 67 to 80%. Normal person में ये कितना होता है left ventricular ejection fraction 67 to 80%. Now if systolic heart failure is there, so it will decrease less than 40%. In case of systolic heart failure, so cardiac this left ventricular ejection fraction is less than 40%. In case of severe heart failure, बहुत ज़्यादा heart fail हो गया आपका, so in that case this left ventricular ejection fraction will decrease up to 20%. So left ventricular ejection fraction, if it is only 20%, that means you need immediate treatment. Okay, otherwise you will die. Okay, so that is known as severe heart failure. So sensitive index क्या है heart failure का, और what is the sensitive index, or what is the sensitive determinant for cardiac output? There is a left ventricular ejection fraction. Okay, so amount of blood that is being pumped up by left ventricle per stroke, एक बीट में लेफ्ट वेंट्रिकुलर से आपका कितना ब्लड बाहर निकल रहा है, उसको बोलेंगे लेफ्ट वेंट्रिकुलर इजेक्शन फ्रैक्शन. जो नॉर्मल ब्लड होता है आपका, जैसे मान लीजिए नॉर्मल ब्लड आपका 100% क्या कंसिडर कीजिए, उसमें का 67 to 80% दैट इज अ नॉर्मल इजेक्शन फ्रैक्शन. ये नॉर्मल लोगों में होता है. अगर आपको सिस्टोलिक हार्ट फेल्यूर है तो लेफ्ट वेंट्रिकुलर इजेक्शन फ्रैक्शन आपका लेस देन 40% रहेगा, एंड इफ यू आर सफरिंग फ्रॉम सीवियर हार्ट फेल्यूर देन इट विल बी अराउंड 20%. नाउ पैथोफिजियोलॉजी ऑफ कंजेस्टिव हार्ट फेल्यूर, इसके पीछे रीजंस क्या है, ठीक है, व्हाट इज द रीजन बिहाइंड हार्ट फेल्यूर. सो हार्ट फेल्यूर इज नथिंग बट द फेलिंग हार्ट. ओके, फेलिंग हार्ट इज कैरेक्टराइज्ड बाय inability to provide sufficient cardiac output to meet the body's demand. Okay, now heart failure may is nothing but the failure of heart to act as a pump, and mostly that is due to left ventricle. Okay, so most of the blood is pumped by left ventricle. Now this heart failure may be due to different reasons like pressure overload. Okay, so pressure load overload, as in case of hypertension or stenosis of cardiac valves. जो आपका साइनोएट्रियल वाल्व है या फिर मिट्रल वाल्व है, उसका स्टेनोसिस मतलब वो बंद हो गया है, या फिर आपको सीवियर हाइपरटेंशन है, सो दैट विल कॉज प्रेशर ओवरलोड ऑन योर हार्ट, and it is one of the cause for congestive cardiopathy. Another cause is nothing but the volume overload. So if there is a drastic increase in the blood volume due to congenital disease, due to genetic disease, or then regurgient lesions, that means there is a wound in the mitral valve. If mitral valve is damaged, so that can also increase the volume overload, and that is one of the cause for congestive cardiopathy. देन लॉस ऑफ कार्डियक मसल, ठीक है। तो कंजेस्टिव कार्डियक फेलियर क्यों होता है? प्रेशर ओवरलोड हो गया, हार्ट के ऊपर बहुत प्रेशर आ गया, फिर हार्ट को वॉल्यूम का ओवरलोड हो गया, या फिर हार्ट का मसल लॉस हो गया। तो हार्ट का मसल कैसे लॉस हो गया? सो ड्यू टू ischemic heart disease, due to myocardial ischemia or angina pectoris or anything. So if there is a less blood supply to heart, so myocardial muscle will start dying, and that is nothing but loss of cardiac muscle. So this congestive cardiac failure may be due to pressure overload, volume overload, loss of cardiac muscle, or decreased contractility due to infection of myocardium. Restricted cardiac filling in case of your in case of constrictive pericarditism. Okay, so diastolic heart failure. So these are nothing but the different reason for heart failure. Now compensatory mechanism. तो हार्ट फेलियर में क्या हो रहा है कि आपका कार्डियक आउटपुट डिक्रीज हो रहा है. नाउ योर कार्डियक आउटपुट इज डिक्रीजिंग इन केस ऑफ हार्ट फेलियर, ओके, व्हिच इज नॉट सफिशिएंट टू मीट द बॉडीज डिमांड. आपके बॉडी के लिए लग रहा है 70% कार्डियक आउटपुट लग रहा है, मान लीजिए ऑन एन एवरेज आपकी बॉडी को 70% कार्डियक आउटपुट लग रहा है, लेकिन आपका हार्ट क्या कर रहा है? ओनली 30% दे रहा है, 30%, 20%, 40%. So that is not sufficient to meet the body's metabolic demand. So that means you are suffering from congestive heart failure. To compensate that, उसके अगेंस्ट में बॉडी क्या करती है? So body will try to increase the cardiac output by their own. Okay, body will try to increase the cardiac output by its compensatory mechanism, and that is nothing but the by stimulation of your sympathetic nervous system. It will stimulate the sympathetic nervous system, it will release the noradrenaline, noradrenaline will go, it will act on its receptor, like alpha receptor. By acting on alpha receptor, it will cause vasoconstriction, it will increase the preload, okay. Then by stimulating the beta 1 receptor, it will increase the heart rate and cardiac output for short term, okay. But after all, it is increasing the preload, it is increasing the heart rate, means it is again increasing the oxygen consumption by heart, okay. Then again, due to decreased cardiac output, there will be decreased the blood flow to kidney. कार्डियक आउटपुट कम हो गया आपका, तो ब्लड फ्लो कम हो जाएगा किडनी को, तो वहां पे रेनिन, एंजियोटेंसिन, अल्डोस्टेरोन सिस्टम एक्टिवेट हो जाएगा. तो वो क्या करेगा? एंजियोटेंसिन जो एंजियोटेंसिनोजन का कन्वर्जन एंजियोटेंसिन 1 का 2 में करेगा. कौन करेगा? एस, एंजियोटेंसिन कन्वर्टिंग एंजाइम. और एंजियोटेंसिन सेकंड क्या करेगा? वैसोकंस्ट्रिक्शन करेगा. अगेन वो क्या करेगा? प्री लोड एंड आफ्टर लोड बढ़ा देगा. और साथ में उसके साथ में क्या करेगा? वो एंजियोटेंसिन सेकंड विल स्टिमुलेट द अल्डोस्टेरोन आल्सो. एल्डोस्टेरोन क्या करेगा? फ्लूइड एंड वाटर रिटेंशन, किडनी से यूरिन नहीं बनने देगा, वो ज्यादा फ्लूइड रिटेन करेगा. दैट मींस इट विल अगेन इंक्रीज द वॉल्यूम ऑफ ब्लड. सो दिस बोथ कॉम्पेंसेटरी mechanism for a short term increases the cardiac output, but they also helps for the congestion. They also help for the congestion, and they also increases the workload on your heart. So that's why you need a treatment over here. So what is the treatment? Okay, so we'll see one by one. Again, I will explain why there is a heart failure. You can see over here in this acute heart failure. Acute heart failure. Why? Acute heart failure means there is a decreased cardiac output. Your heart is not able to pump the blood properly. Whatever is required for your body, so heart will not able to pump that amount of blood. So decrease the contractility. Okay, so decrease the contractility means decrease the cardiac output. So when there is decreased cardiac output, there will be stimulation of compensatory mechanism. आपकी बॉडी के ही मैकेनिज्म होते हैं, जैसे आपके आवर्टा में बैरो रिसेप्टर होते हैं, जैसे वहां पे कार्डियक आउटपुट कम हो गया तो वो सिग्नल करेगा ब्रेन को. सो बैरो रिसेप्टर विल सिग्नल द ब्रेन, एंड ब्रेन विल increase the sympathetic output. It will increase the sympathetic activity. That means it will release the noradrenaline. Okay, so noradrenaline will do two things. Noradrenaline will do three things. First thing it will do, it will go in the vascular bed means blood vessel में जाएगा, and it will stimulate the alpha 1 receptor. So by stimulation of alpha 1 receptor, it will cause vasoconstriction, and it will increase the preload. Okay, preload by acting on a arteriolar by causing the contraction of arteries, it will increase the afterload. तो ये जो नॉरएड्रेनलिन है वो आर्टरीज एंड वेन्स में जाके उनको कॉन्ट्रैक्ट करेगा. तो वेन्स को कॉन्ट्रैक्ट करने के बाद प्रीलोड बढ़ता है, आर्टरीज को कॉन्ट्रैक्ट करने के बाद आफ्टरलोड बढ़ता है. ओके, then again this noradrenaline will do again do another thing known as, it will stimulate the beta 1 receptor of your heart, and it will try to increase the cardiac output. It will try to increase the cardiac output. And third thing, again noradrenaline will do this. It will stimulate the juxtaglomerular cells of kidney, juxtaglomerular cells of kidney, to release the renin. Now renin, what is the function of renin? Renin will convert angiotensin to angiotensin 1, and this angiotensin 1 will be converted by ACE, angiotensin converting enzyme. Angiotensin converting enzyme convert angiotensin 1 to angiotensin second. This angiotensin second is nothing but the vasoconstrictor peptide. It will cause vasoconstriction, okay, and increases the preload as well as afterload. Vasoconstriction मतलब blood vessel, ठीक है, blood vessel में arteries vein दोनों भी आते हैं. So it will increase the preload as well as afterload. Okay, then again angiotensin second will also stimulate this aldosterone. Okay, and what will this do? Aldosterone will increase the sodium and water retention, and it will increase the blood volume again. That means the compensatory mechanism are for increasing the cardiac output, but they increases the workload on heart in case of congestive cardiac failure, and that's why you need to block the compensatory mechanism. Okay, so how can you block? There are different drugs, there are different kind of drugs that can be used in the congestive cardiac failure. So what are these? So they are nothing but the, so you can decrease the preload and afterload on heart by blocking the noradrenaline receptor, alpha receptor. So alpha blockers are used. Okay. You can decrease the preload. You can decrease the preload. Preload means venous return. Whatever blood is returned to your heart by veins, that is known as a preload. You can decrease this by dilating the veins by using nitrates. Okay. You can decrease the afterload. Okay, afterload by again dilating the arteries by hydrolyzing. Okay. You can decrease both preload and afterload by blocking this alpha 1 receptor. Okay. Then again, so again you can block this beta 1 receptor, and block this beta 1 receptor. Though blocking of beta 1 receptor will decrease the cardiac output, but also decrease the secretion of renin and angiotensin 1. Okay. जैसे ये secretion कम होगा तो आपके वॉल्यूम भी कम हो जाएगा और प्रीलोड आफ्टरलोड भी कम हो जाएगा. So you can also prevent this by inhibiting the angiotensin converting enzyme inhibitors. So that will prevent the formation of angiotensin second, and then it will not increase the preload afterload and volume retention. Again, you can prevent this by using angiotensin receptor blockers. You can also prevent increase in the blood volume. That can be prevented by spironolactone. Spironolactone will act as an aldosterone antagonist and will prevent the sodium and water retention. These are the different drugs that can be used in the congestive cardiac failure. But these drugs, they are not increasing the cardiac output. They are just decreasing the peripheral resistance. They are just decreasing the volume of blood. They are just decreasing the preload and afterload. So they are not improving the muscle function. So what is basically in the cardiac failure? So your muscle is having less strength. आपका जो myocardium है उसमें strength कम हो गया. So there is no forceful contraction, and that's why you need a forceful contraction. Okay. So how you can increase the forceful contraction? By using inotropic drug, by using positive inotropic drug or cardiac glycosides. Okay, we'll see it in the upcoming slides. So this is again a compensatory mechanism. कैसे होता है उसमें, जैसे myocardial muscle अगर weak हो गया या फिर loss हो गया, so myocardial inadequacy leads to decreased cardiac output. Decreased cardiac output leads to stimulation of compensatory mechanism, that is nothing but the sympathetic stimulation and renin angiotensin system activation, so which will again increase the preload, afterload and volume of blood. So I already explained this in the previous diagram. So there is different kind of drugs used in the congestive cardiac failure. So I have already told you. So angiotensin receptor blockers can be used. Positive inotropic means those drugs which will increase the force of contraction, they can be used. Calcium channel blockers can be used. Vasodilators can be used. Alpha blockers, beta blockers can be used. But these drugs, they will not increase the myocardial functioning. Okay. So only digitalis is the drug. Digitalis means digoxin and digitoxin, known as the cardiac glycosides. they can increase the functioning of your heart. So if your heart failure is a third stage, okay. Now first we'll see the different drugs. What will they do? So first one is the ACE inhibitors or angiotensin converting enzyme inhibitors. So in that we'll see first vasodilators. So vasodilators means they will dilate the blood vessel. blood vessel को dilate करेंगे. तो blood vessel को dilate करेंगे तो जो blood heart को जा रहा है वो क्या होगा, कम होगा. So they will reduce the afterload. So vasodilators will reduce the afterload produced in response to activation of sympathetic system. Then they are different type: arterial vasodilator or arteriolar vasodilator. Arteriolar arteriolar vasodilator means they will dilate the only arteries. Artery is an example. Then venular dilator, that means they dilate only veins, nitrates. Both arteriolar and venular dilator means they will dilate both arteries as well as veins. Arterial and venous dilator, that means example prazosin, ACE inhibitors, angiotensin receptor blockers, nitroprusside. All these are the arteriolar plus venodilator. So they used to control the hypertension in the congestive cardiac failure, which is the one of the risk factor for congestive cardiac failure. तो जैसे hypertension अगर ज़्यादा होगा तो उसमें heart fail हो सकता है. These drugs are used to control the hypertension in the CHF. Okay, two, and they prolong the survival time of patient. They reduces the clinical progression of congestive cardiac failure. मतलब ये जो ड्रग है जैसे डायलेटर, वैसोडाइलेटर्स. ओके, वैसोडाइलेटर क्या करेंगे कि ब्लड वेसल को डायलेट करेंगे. जो प्री लोड होता है या फिर आफ्टर लोड होता है हार्ट के ऊपर बढ़ रहा है उसको कम करेंगे. ठीक है, तो थोड़ा सा हार्ट का लोड कम करेंगे. ठीक है, एंड दे विल डिक्रीज द हाइपरटेंशन इन द congestive cardiac failure by dilating the blood vessels. Okay, and they will prolong the survival time. मतलब मान लीजिए कि ये ड्रग नहीं दिया तो अगर पेशेंट एक हाफ आवर में मरने वाला है और ये ड्रग दे दिए तो ये हाफ आवर के बाद बजाय 2 या 3 घंटे बाद मरेगा. मतलब ये दे इंक्रीज द प्रोलॉन्ग द सर्वाइवल टाइम and reduces the clinical progression of disease. Now another category of drug is nothing but the ACE inhibitors. ACE inhibitors means angiotensin receptor converting enzyme inhibitors. So we have seen these drugs in the antihypertensive chapter like captopril, enalapril, ramipril, all these. So they are used to treat the patient with the symptomatic congestive cardiac failure associated with the less systolic left ventricular ejection fraction. मतलब जिसका ejection fraction कम हो चुका है तो उसको symptomatic treatment के लिए ACE inhibitors आप use कर सकते हैं. And they are also used in the management of acute congestive heart failure due to myocardial infarction. Therapy of choice is nothing but the infusion of sodium nitroprusside or nitroglycerin. So nitroglycerin and sodium nitroprusside क्या है? These are known as vasodilators. So they are the therapy of choice. Now another category, okay. So different kind of drugs used in the heart failure. So yes, of ACE inhibitors, then vasopeptidase inhibitors, positive inotropic drugs, cardiac glycosides, then ACE inhibitors, calcium channel blockers, angiotensin receptor inhibitors, okay, then diuretics. These are the different classes. इसका कोई separate classification नहीं दिया. Next category is the vasopeptidase inhibitors. So vasopeptidase is nothing but the enzyme. Vasopeptidase is the enzyme present in the different structure like kidney, lungs, intestine, heart and blood vessels. Vasopeptidase नाम का एक एंजाइम है वो प्रेजेंट होता है ब्लड में, ब्लड वेसल्स में, हार्ट में प्रेजेंट होता है, ब्रेन में प्रेजेंट होता है एंड किडनी में भी प्रेजेंट होता है. So what is the function of this enzyme? So it is responsible for the metabolism of peptides. It is responsible for the metabolism of peptides. कौन से peptide? First is nothing but the atrial natriuretic peptide. Atrial natriuretic peptide. ये peptide क्या होता है? So when there is a decrease in the cardiac output, so this peptide is released from the atrium of your heart. आपका जो हार्ट का एट्रियम होता है वहां से ये पेप्टाइड रिलीज होता है, एट्रियल नाइट्रियोटिक पेप्टाइड एएनपी. ओके, इन रिस्पांस टू डिक्रीज्ड कार्डियक आउटपुट. क्या काम करता है? सो एट्रियल नाइट्रियोटिक पेप्टाइड विल डू टू थिंग्स. इट विल फर्स्ट डायलेट द ब्लड वेसल एंड इट विल also depresses the renin angiotensin converting enzyme aldosterone system. So it will decrease the renin angiotensin system and it will also cause the vasodilation. So So that is the function of this atrial natriuretic peptide. So it is released in response to decreased cardiac output, and now this is metabolized by this vasopeptide. So your ultimate aim should be to increase the atrial natriuretic peptide. So that's why vasopeptidase inhibitors, they are useful in the congestive cardiac failure. So vasopeptidase inhibitor will inhibit this vasopeptidase enzyme and thereby increase the atrial natriuretic peptide. Okay, and thereby decrease the preload, upload, and decrease the aldosterone, the renin angiotensin aldosterone axis. Okay. Now again, this vasopeptidase enzyme is also responsible for the metabolism of some other peptide like bradykinin. Okay. So inhibition of this result in the vasodilation and sodium excretion. Okay. And protection of this atrial natriuretic peptide. What are these drugs? These drugs are nothing but the first one is a omaprelate. Omaprelate is a vasopeptidase inhibitor and can cause atrial and venous dilation as well as natriuresis. This increased urine formation. Increased urine formation will decrease the volume of blood, okay, and that will decrease the workload on heart. And then another drug is there, nesiritide. Nesiritide is a recombinant human B type of natriuretic peptide known as a BNP. ANP is known as a atrial natriuretic peptide, which is secreted by, ये कहाँ से आता है atrial natriuretic peptide? आपका हार्ट जो है, हार्ट का जो एट्रियम होता है वहां से आता है. Atrial natriuretic peptide is secreted by atrium of your heart. And this nesitride is recommended human B type of natriuretic peptide. So BNP, ANP and BNP. Okay, they combines with the receptor on vascular smooth muscle and endothelial cells of the muscle and causes the atrial as well as venous dilation. मतलब ये आर्टरी को डायलेट करेगा एंड वेन्स को भी डायलेट कर देगा. That's why they decrease the preload as well as afterload. Now again you can see your another class of drug used in the this congestive cardiac failure is nothing but the diuretics. Diuretics, okay. So particularly your loop diuretics, they are used to relieve the sodium and water retention. तो हार्ट फेलियर में क्या होता है कि ड्यू टू डिक्रीज्ड कार्डियक आउटपुट आपके हार्ट में ब्लड जमा होता है और जो पल्मोनरी ब्लड वेसल है उसमें भी ब्लड जमा रहता है एंड दैट कॉजेज द इडिमा. वहां पे सूजन करता है, इडिमा करता है. और बाकी के जो पेरिफेरल ब्लड वेसल है उसमें भी ब्लड जमा होता है और वहां पे भी इडिमा होता है, तो सूजन आता है आपको. To relieve that, they are used to decrease the sodium and water retention, and this causes the diuresis and decreases the volume. Okay, volume, and they relieve the pulmonary congestion. So they are used to decrease the pulmonary congestion. As such, they will not improve any ventricular function. ये जो diuretics है ये कोई ventricles के मसल को स्टिमुलेट वगैरह करेंगे नहीं, कार्डियक आउटपुट इंक्रीज करेंगे नहीं, बट ये क्या करेंगे कि ये जो वॉल्यूम इंक्रीज हुआ है ब्लड का वो डिक्रीज करेंगे. They relieve the symptom of congestion. So diuretic of choice are nothing but the loop diuretic like furosemide, bumetanide. Spironolactone is the only drug which can decrease the mortality in patient with the congestive cardiac failure. So spironolactone, then loop diuretics, they are used. Okay. Remember, spironolactone is the only drug which can decrease the mortality. Mortality matlab the percentage of death. So spironolactone is the only drug which can decrease the mortality with the patient with congestive cardiac failure. Now another class is nothing but the aldosterone antagonist, spironolactone. Okay, there is aldosterone. Then iprelenone is another aldosterone antagonist. In addition to mineralocorticoid, aldosterone causes coronary renovascular remodeling. ठीक है, remodeling मतलब क्या है? ठीक है, because of decreased cardiac output आपके हार्ट में ब्लड जमा होने लगता है और आपका हार्ट जो है डायलेट हो जाता है. So heart will start remodeling itself. So there is a hypertrophy of your ventricles. Ventricles enlarge हो जाएंगे. That is known as remodeling. So endothelial cells and their receptor dysfunction. Spironolactone is used in combination with the angiotensin converting enzyme inhibitors. Spironolactone and iprapiolone. These two drugs are the aldosterone antagonists. Now beta blocker, another category. Beta blockers like your propranolol and metoprolol, atenolol, etc. So in the large doses, they are used in the large doses to begin the therapy, which can worsen